Are you, or perhaps a loved one, feeling unusually tired lately, or maybe noticing some unexplained swelling? These are pretty common complaints, especially among older adults, but they could actually be silent alarms for a serious kidney issue. And ignoring them? Well, that's really not an option. Understanding what to look for can truly be life-saving. That's why recognizing the symptoms of dangerously high creatinine levels in older adults is so crucial for early intervention and, importantly, for preventing severe kidney complications. So, in this discussion, we're going to explore the top 6 symptoms, what they really mean, and what steps should be taken if these warning signs pop up. Number 1, fatigue and weakness. One of the most widespread and often misunderstood symptoms of high creatinine levels is this overwhelming sense of fatigue and just generalized weakness. See, when your kidneys aren't working at their best, they have a tough time filtering out waste products like creatinine from the blood. This buildup of toxins, which doctors call uremia, can directly hit your energy levels, leaving you feeling constantly drained and just plain tired. And we're not talking about the usual tiredness you might feel after a busy day or if you didn't sleep well. No, this is a deep, persistent exhaustion that doesn't just go away with a bit of rest. Older adults might find that things they used to enjoy or manage easily now take a huge amount of effort, or maybe they're just too tiring to do at all. Even simple tasks like walking, climbing a few stairs, or doing light chores around the house can feel like climbing a mountain. What's more, when kidney function is impaired, it can lead to less production of a hormone called erythropoietin. This hormone is vital for making red blood cells. Fewer red blood cells mean less oxygen gets to your muscles and brain. This can result in anemia, which is a big reason for feeling weak, tired, and sometimes even lightheaded. This lack of oxygen, on top of the toxic waste buildup, makes the fatigue even worse. The impact this has on daily life can be huge. This constant lack of energy can lead to not moving around as much, a higher risk of falls, pulling away from social activities, and a real drop in overall quality of life. It can be incredibly frustrating for older adults who really value their independence, as they might find themselves needing more help with everyday things. So, it's really important to tell the difference between this kind of fatigue and the normal tiredness that can come with aging or other health conditions. If this fatigue is something new, if it's gotten a lot worse, or if it comes along with other symptoms we'll talk about, it really shouldn't be brushed off. Telling your doctor about such deep and unexplained tiredness is a critical step in spotting potential kidney issues before they get more serious. So, while feeling tired is common, its link to kidney health is incredibly important to recognize. And speaking of physical signs, beyond just feeling tired, there's another physical symptom that often shows up, pointing towards problems with how the body handles fluids. Number 2, swelling in legs, ankles, and feet, edema. Another really noticeable sign of potentially dangerous creatinine levels and kidney problems is developing swelling, or edema, especially in the legs, ankles, and feet. You see, healthy kidneys are crucial for keeping the body's fluid balance in check by getting rid of excess fluid and sodium. When kidney function goes down, this ability is weakened, and that leads to fluid retention. This extra fluid usually builds up in the body's tissues, and because of gravity, it most often shows up in the legs, ankles, and feet. The swelling might come on slowly, or it could appear quite suddenly. A classic sign of this kind of edema is something called pitting. That's when you gently press a finger on the swollen area for a few seconds, and it leaves a temporary dent in the skin. The areas that are swollen can feel tight, heavy, and pretty uncomfortable. Shoes might suddenly become hard to put on, or rings might feel tighter if the swelling is more widespread. While the legs, ankles, and feet are the usual spots, edema can also pop up in the hands, face, or around the eyes, particularly in the morning. In really severe cases, fluid can even build up in the abdomen, that's called ascites, or in the lungs, which then causes breathing problems. This swelling can really affect an older adult's ability to move around and their overall comfort. Heavy swollen legs can make walking tough and also increase the risk of falls. The skin over these swollen areas can get stretched, become fragile, and be more prone to injury or infection. Plus, ongoing edema can be a sign that the heart is having to work harder to pump blood through a system that's overloaded with fluid. Now, a little bit of minor swelling can sometimes happen if you've been standing for a long time or if it's hot out. But if you see persistent or worsening edema, especially if it comes with other symptoms like fatigue or shortness of breath, that's a major red flag. It strongly hints that the kidneys aren't managing fluid balance properly and definitely needs a doctor to check it out to find the cause and see how the kidneys are doing. So, while swelling is something you can see, the internal effects of high creatinine can also show up in ways that mess with basic bodily functions, like our digestion. Number 3, nausea and vomiting. Persistent nausea and unexplained vomiting can be really distressing, and they can be a sign of dangerously high creatinine levels and advancing kidney disease. What happens is, as waste products like urea build up in the bloodstream because the kidneys aren't filtering properly, a state we called uremia earlier, these wastes can directly irritate your digestive system. This irritation often shows up as a constant feeling of sickness in your stomach, or nausea. It might be worse in the morning, or after you eat. For some older adults, this nausea can actually lead to vomiting. And unlike the occasional upset stomach you might get from something you ate or a stomach bug, nausea and vomiting caused by uremia tend to be chronic and don't usually get better with the typical remedies you buy at the pharmacy. This constant feeling of nausea can really mess with a person's appetite. It can lead to eating less and just a general lack of interest in food, a condition known as anorexia. This is especially worrying for older adults because poor nutrition can quickly cause weight loss, muscle wasting, and even more weakness, making that fatigue we talked about from kidney dysfunction even worse. On top of that, frequent vomiting brings the risk of dehydration and electrolyte imbalances. These can put even more strain on kidneys that are already struggling and affect overall health. It kind of becomes a nasty cycle where the symptoms of kidney disease lead to conditions that can make kidney function even worse. So, it's really important for older adults and anyone caring for them to realize that new or ongoing nausea and vomiting, especially if there's no other clear reason for it, shouldn't be ignored. While these symptoms can have many causes, their link to high creatinine and uremia makes them important clues for underlying kidney problems. Getting medical advice is key to find out the cause and manage these symptoms properly to prevent more nutritional problems and other complications. Now, just as the digestive system can be affected, our breathing can also show signs of trouble when the kidneys aren't working well. Number 4, shortness of breath. Experiencing shortness of breath, or what doctors call dyspnea, can be a really frightening symptom. It might mean that high creatinine levels are affecting more than just the kidneys, particularly the respiratory and cardiovascular systems. There are a couple of main ways kidney problems can lead to trouble breathing. First, severe kidney disease can cause fluid overload. When the kidneys can't get rid of enough fluid from the body, this extra fluid can build up in the lungs. This is a serious condition called pulmonary edema. This fluid in the air sacs of your lungs makes it hard for oxygen to get into your bloodstream, which leads to that feeling of breathlessness. At first, this shortness of breath might only happen when you're exerting yourself, but it can get worse and happen even when you're resting or lying down flat. That's called orthopnea. This often makes people need to sleep propped up on several pillows. Second, as we touched on earlier, Kidney disease can lead to anemia because of that reduced production of erythropoietin. Anemia means you have fewer red blood cells to carry oxygen around your body. When your organs and tissues don't get enough oxygen, the body tries to make up for it by making you breathe faster, which can feel like shortness of breath, especially when you're active. This sensation can range from just a mild feeling of not being able to quite catch your breath to severe difficulty breathing. It's a symptom that should always be taken very seriously because it can point to significant fluid in the lungs or severe anemia, both of which need urgent medical attention. For older adults, any new or worsening shortness of breath means it's time to see a healthcare provider right away. It's so important to find out if it's related to kidney function, heart problems, or other lung conditions to make sure the right treatment is given quickly. While breathing difficulties are a very serious concern, changes in a more basic kidney function, urination itself, also give us direct clues about what's going on. Number 5, changes in urination, frequency, appearance, volume. Since the kidneys are the main players in producing urine, it's really no surprise that changes in your urination patterns can be direct signs of declining kidney function and high creatinine levels. Noticing these changes can give us some really important clues about kidney health. One big change can be a decrease in how much urine you're producing. If the kidneys aren't filtering blood efficiently, they might make less urine than usual. In some situations, urine output can drop quite a lot. That's called oliguria, or it might even stop completely, which is anuria, and that's a medical emergency. On the other hand, some people with early to moderate kidney damage might find they need to urinate more often, especially at night, a condition called nocturia. This can happen because damaged kidneys aren't as good at concentrating urine, so more fluid is passed more frequently. While many older adults experience some nocturia for other reasons, if it's new or has noticeably increased, that's something to pay attention to. The way urine looks can also change. It might become foamy or bubbly, which could mean there's excess protein in it. That's called proteinuria, and it's a common sign of kidney damage. Healthy kidneys filter waste and water, but keep essential proteins in the body. Damaged kidneys, though, might let protein leak into the urine. Urine might also look darker, or in some cases of kidney disease or urinary tract problems, it might have blood in it, hematuria, which can make it look pink, red, or even cola-colored. So, these changes, whether it's how often you go, how much you produce, or what your urine looks like, are all important signals from your body. Because urination is such a basic bodily process, any alterations are often quite noticeable. Paying attention to these urinary signs and telling your doctor about them can lead to spotting and managing kidney problems much earlier. Now, moving beyond physical symptoms like urinary changes, it's also important to know that high creatinine levels can affect how our brain works, sometimes in ways that are quite subtle. Number 6. Confusion or changes in mental status. When creatinine and other waste products build up to really high levels in the blood, because kidney function is severely impaired, they can actually affect brain function. This can lead to a variety of neurological symptoms, including confusion or noticeable changes in someone's mental state. This condition is sometimes called uremic encephalopathy. The symptoms can range from mild to severe and might come on gradually. This can sometimes make them hard to spot at first, especially in older adults where subtle changes in thinking might be incorrectly blamed on just normal aging. Early signs can include things like difficulty concentrating, feeling more drowsy during the day, lethargy, or just a general fogginess in thinking. Memory problems and a shorter attention span might also start to show up. As this uremia gets worse, these cognitive symptoms can become much more obvious. People might experience significant confusion, feel disoriented about time or where they are, and have noticeable changes in their personality or behavior, like becoming more irritable or apathetic. In very severe cases that aren't treated, uremic encephalopathy can progress to delirium, seizures, or even a coma, which really underscores how critical this symptom is. For those who are caring for older adults, or for family members, it's especially important to keep an eye out for any new or worsening confusion, unexplained drowsiness, or changes in their cognitive abilities. While conditions like dementia can also cause these kinds of symptoms, the chance of underlying kidney failure has to be considered, particularly if other symptoms of high creatinine are also present. It's absolutely essential to get a medical evaluation quickly if these kinds of mental status changes are noticed. Identifying and treating the underlying kidney problem can often help improve these neurological symptoms. So, recognizing these cognitive shifts is incredibly important, just as it's important to understand other, perhaps less common, signs that might come along with these major symptoms. Other associated symptoms and when to worry. So, beyond those 6 main symptoms we've discussed, there are other signs that can also be linked to high creatinine levels and kidney problems. These might include persistently itchy skin, which doctors call pruritus. This is thought to be caused by that buildup of waste products and imbalances in phosphate. Some people might notice a metallic taste in their mouth, or what's called ammonia breath. That's due to urea breaking down, and this can often make people lose their appetite. Others might experience muscle cramps, especially in the legs, or something called restless leg syndrome. Now, what's really crucial to understand is this. If any of the 6 main symptoms we've talked about, that's fatigue, swelling, nausea, shortness of breath, changes in urination, or confusion, start to appear, especially if they're new, getting worse, or if you're noticing a few of them together, then it is absolutely time to worry and get medical attention quickly. Please, don't just brush these signs off as a normal part of getting older. Catching things early and getting treatment are so key to managing kidney disease and preventing more serious complications. Why older adults are at greater risk. Older adults naturally face a higher risk of developing high creatinine levels and kidney disease, and there are several reasons for this. First off, there's a natural decline in kidney function that comes with age. Even in healthy people, the kidney's ability to filter can slowly decrease over time. Secondly, older adults are more likely to have chronic conditions that are major risk factors for kidney disease, things like diabetes and high blood pressure. If these conditions aren't well managed, they can cause significant damage to the kidneys over the years. And then there's the fact that older individuals often take multiple medications, sometimes called polypharmacy, for various health issues. Some of these medications, including common ones like non-steroidal anti-inflammatory drugs, you might know them as NSAIDs, or certain antibiotics, can potentially harm the kidneys, especially if kidney function is already a bit weak. Also, the symptoms of kidney disease in older adults can sometimes be less specific, or they might be mistakenly blamed on other age-related conditions, and this can lead to delays in getting diagnosed and treated. Prevention and monitoring tips. While we can't prevent all kidney disease, taking proactive steps can definitely help protect kidney health and catch problems early, which is especially important for older adults. Regular medical checkups that include kidney function tests, like a serum creatinine test, and something called an estimated glomerular filtration rate, or eGFR, are really vital. Managing any underlying conditions is absolutely key. So, keeping blood sugar levels under control if you have diabetes and maintaining healthy blood pressure are both crucial for keeping your kidneys working well. Staying well hydrated by drinking enough water helps your kidneys flush out toxins. It's also really smart to be careful with medications. Try to avoid overusing those NSAIDs we mentioned, and always talk to your doctor about any new medications you're taking, including drugs you can buy over the counter and any supplements, just to understand how they might affect your kidneys. Adopting a kidney-friendly diet can also be a big help. This often means a diet that's low in sodium, phosphorus, and potassium, usually as advised by your doctor or a dietitian. Dangerously high creatinine levels act as a serious warning sign that kidney function is compromised. This can have life-threatening consequences, particularly for older adults. Recognizing the key symptoms we've explored today and getting prompt medical evaluation are absolutely vital for protecting kidney health and your overall well-being. Please consider sharing this information with your friends and family to help raise awareness about these warning signs of kidney problems in older adults. If you're interested in more health insights, do subscribe. And we'd love to hear from you. Please leave a comment below if you have any questions or perhaps personal experiences you'd like to share. Your story really might help someone else who needs it.